Hello. Happy New Year, everyone. I am Laura Mitchell. I am head of our pay equity practice group here at Jackson Lewis, and I'm thrilled to be back for another episode of our pay transparency podcast series. And today I am joined by two of my most favorite people, Sarah Skubis and Stephanie Pete, who lead our healthcare industry group. And today we're going to talk to them about the trends, the pitfalls, the challenges that our clients in this healthcare industry are seeing. But Sarah, first, for those who are listening who aren't familiar with our healthcare industry group, you want to tell us a little bit about what it is and what you all do for our Jackson Lewis clients?
Yeah, definitely. Great to be with you, Laura, and you too, Stephanie, as always. And Laura, you, for the record, are one of my favorite people as well. So we do a lot of different things within the healthcare industry group. Jackson Lewis has a lot of industry groups that really pride ourselves on understanding our clients' industry so we can provide them with benchmarking, updated trends, and really understanding their business. And healthcare is no different. Stephanie and I and a very deep bench at Jackson Lewis really focus on partnering with our healthcare clients on a variety of issues, right? We really understand the trends and unique challenges that face the industry. That may be anything from physician organizing trends in the labor space to litigating cases that implicate sort of the crossover we see when employed physicians have issues, but also medical staff privilege issues arise. And we don't just litigate cases in the healthcare space. We really partner with clients to understand both from a preventative and an advocacy piece how we can help maximize all the challenges they're facing. Healthcare is the largest employer. It's not going anywhere. And we understand how important it is to be there to support clients at every step. So it's a real honor for Stephanie and I to co-lead the group and partner with the rest of our colleagues across the firm.
Fantastic. Well, today we're talking about the wave of pay transparency laws rolling out across the country. And on our last episode, I talked with Chris and Stacy generally about the challenges facing employers navigating kind of these patchwork of laws. And so given your insight into this industry and the type of employers in this space, what are you seeing as the biggest or most common challenges for organizations within the healthcare industry? And Stephanie, I know we've talked about some things that you've seen. You want to share those with us?
Sure. Thanks for having us, Laura. We appreciate it. And Happy New Year, everyone. So there's a lot of complexities. I think one of the biggest ones that we're seeing, and Sarah and I talk about this a lot, is acquisitions. Right. So acquisitions are probably more commonplace in the healthcare industry than in other industries. And while there's a lot of pros with acquisitions, obviously it creates a lot of complexity. One of the complexities is compliance with pay transparency. Right. So if you're acquiring other practices and other healthcare institutions, it is tricky to make sure that you are still compliant with the pay transparency laws in the various states across the country. And it's for a variety of reasons. The first being, it's just hard to identify the pay disparities between the acquiring company, right, and the company being acquired. You can have the same job position, but it could have different job titles. So it's really tricky, right, to harmonize those hundreds of job titles and try and make some sort of unified compensation framework. So I think just figuring out apples and apples is going to be the first complexity that employers have to deal with when they are acquiring different companies. Another kind of difficulty on this is reconciling the salary band structures. So you can have one company and they could use those opaque pay practices, but then you can have another company that publishes their ranges. So trying to kind of mold them into one structure is difficult. Another hurdle that we have seen is inconsistencies that are revealed. You learn this when you're merging that clinical pay. So you, for example, during COVID is a good example. Nurses were hired during shortages. And as a result, they were paid a premium pay. So they may be doing the same job, but their pay is going to look higher than other nurses who were hired at different points in time. And that can throw off pay transparency. Another thing is what we see in the healthcare space. We don't usually see this in other industries, is those different pay structures. So the on-call pay, the hazard pay, the specific shift premium pay can really throw a wrench when you're trying to comply with those pay transparency laws. And one other thing I'm just going to throw out there, more of an internal issue, is inequity claims in pay bands that are disclosed amongst your long tenured staff. Because now all of a sudden they're going to see things and realize the way that people are getting paid that perhaps are newer to the organization or being acquired might be making as much, if not maybe a little bit more than them, can really create issues amongst team morale and productivity. So it's not easy complying with these pay transparency laws, certainly in these acquisition environments.
Mm-hmm. I think that really just highlights how it's the pay transparency requirements, the disclosure on your job postings of your pay bands really does tie into pay equity concerns, right? If you're not paying individuals the same that are doing similar jobs, that's going to come out when you have to post on a job requisition or a job opening, what that pay is going to be. And then that's going to be seen by your incumbent employees. And then that's going to raise all of these issues. So I think you really just highlighted for us these complexities and the challenges of pay equity practices really coming to light and being highlighted by the pay transparency requirements and obligations from a compliance standpoint. And I can also see how with the acquisitions, just the administration of the pay transparency obligations, like who's responsible for the job postings? Is the information on, the posting for Colorado compliant for acquisition company C? Like who is actually managing this? So I can imagine that for the healthcare clients, like just having a really good compliance hygiene practice is essential when you're taking on all of these different organizations.
I think that's right, Laura.
Mm-hmm. And Sarah, what are some other things I think, that come to mind for me in the healthcare space is you think of healthcare, you think of hospitals, you think of brick and mortar, you think of institutions where you drive to get seen by a practitioner. But we all know in this changing world that remote work now and telehealth and all of these other aspects are coming into play. So how does that fit in with pay transparency and pay equity for our healthcare clients?
Yeah, it's a really great point, Laura. And it's almost like the flip side of what Stephanie's talking about, right? If you're a larger organization and you're acquiring, our smaller healthcare clients are not immune from these challenges for the reason you said, right? Healthcare is one of those industries that was, we'll call it newer to the game of remote work for some of our smaller, or smaller healthcare networks, hospitals, skilled nursing, other healthcare clients where they were used to just brick and mortar, right? They operated and employed people in 1, 2, maybe 3 neighboring states at most. And then COVID hit, and like the rest of the world, they realized that they can tap much needed talent in other states. And we're seeing that a lot in the space of coding, right? So a lot of sort of what we'll call single state employers became 50 state employers unintentionally because they needed the talent pool that they could only hire in other states. And it opened up a world that they didn't really think about before. And so you're seeing what we'll call sort of smaller healthcare employers now becoming multi-state employers. And while pay equity and pay transparency are just one of the multitude of areas of compliance that they're grappling with when you become a multi-state employer, pay transparency laws and the pay equity laws do really vary and change so much that I think it becomes really hard from a compliance standpoint. And so we're seeing a lot of healthcare leaders saying, I understand it's hard, but go figure it out, right? We need to tap this, we need to tap this talent pool, and not just like the coders or the IT, but even the telehealth, right? So I'm seeing clients tapping radiologists who the brick and mortar may be on the East Coast, but they're hiring radiologists on the West Coast because they want somebody to read scans later in the evening to make themselves more marketable. And with that, obviously, triggers a host of various pay transparency obligations in the notices and the posting, but also pay equity, right? So what you're paying a radiologist in a rural healthcare center is going to be wildly different than maybe what the market might be in a more urban or West Coast environment. And so it's a real challenge for those certainly that we partner with a lot in legal and human resources to understand. But sometimes the leadership says, we've got to hire these people, go figure it out. So that's been a real challenge that even though, we're now sort of 5-6 years out, we're still seeing compliance obligations, particularly for some of those smaller organizations who aren't used to being a multi-state employer. It can pose a real big challenge. And so being mindful of, where are we posting for jobs? Where are we going to be an employer? Have we thought critically about what those obligations are from our, whether it be a notice posting for the Indeed posting to the offer letters, and all of those compliance issues are still new for the industry, and something we're going to continue to help clients navigate through.
Yeah. Sarah, can I add on? Yeah. I just wanted to add on to the pay equity issue that we just raised, because I think they are newer in the healthcare space, but they are real. And I think the healthcare employers are struggling with. So we now have this influx of the remote clinical roles that we didn't see before, right? The telehealth, the remote coders, the case managers, et cetera. It's how do you pay them? Do you pay them based on job value, right? Or do you pay them where they live? Because we were finding some healthcare employers are saying, let's use a national rate because that's more fair. And others are saying, no, let's use that geo differential, right? The more of the local rate. So it raises that pay equity concern, Sarah, that you were just talking about, which is you can have two people and they could be doing the identical responsibilities, being paid totally different just because of zip code. I've been seeing a trend towards the national pay scale for more of the remote eligible roles. I don't know if you're seeing the same thing, but I certainly think that as 2026 and 2027 rolls around, and even the future, we're going to see this telehealth expansion continue. And it's probably going to disrupt that old model of that geographic based pay because of that inequity that a lot of people are feeling and seeing.
Totally agree.
Yeah. And I was just going to say, we talk a lot on our podcasts about the pay equity services that we have at JL and how we can actually get in and help organizations evaluate pay from an analytical standpoint to identify where you may have those disparities between similarly situated individuals using statistics and regressions. But from the healthcare industry group practice, as you guys are monitoring trends and you're seeing these new developments, what resources and what do you put out or publish that can help clients kind of navigate and keep their finger on really the pulse of what's going on, not just in the pay equity, pay transparency space, but for healthcare clients in general?
So, Sarah, I know you're going to talk about a lot of our resources that we offer. I want to just focus on a theme that we're seeing in the healthcare space and how we can help healthcare employers deal with that. And it's one word, it's disgruntlement. I think what we're seeing and hearing among healthcare providers, doctors and nurses, is people are upset. They feel overworked. They feel underpaid, lack of support, lack of resources, hostile work environment, you name it. And how does that play itself into employment law? Well, you see a myriad of issues that result from this disgruntlement. We're seeing increases in requests for ADA. Doctors and nurses and other healthcare providers, they're requesting accommodations more than they have before, in large part due to these mental health issues. We're seeing increased requests for FMLA, both continuous and intermittent. The biggest one that we're seeing is unionization attempts. by doctors and by nurses. And it's something that we never even thought would happen. We're actually seeing happen now. And it's because they just feel that there's this lack of help and lack of resources within their own employment. And the other issue we're seeing is workplace safety. We have experts that can help you in the healthcare space deal with all of these issues, the labor, the workplace safety, the leave issues. So we're here to help, but they all come from that common theme that we're seeing in healthcare, which is disgruntlement.
Yeah. And we have a Keeping Pace with Industry Concerns series where we touch upon all of these issues specific to the healthcare industry lens. We do webinars and podcasts, but you name the topic, we've probably talked about it, and we're continuing to develop new content where clients can go check it out, listen to it on the way to work. But I think to echo Stephanie, it's we were used to like physicians not suing other than a breach of contract, right? And those days are gone. Physicians are a whole new avenue of risk for our healthcare clients. And particularly when we build in things like looking at residency programs, and the ACGME is the accrediting oversight board nationally that regulates all of the residency programs at hospitals. And we're seeing a really informed residency workforce. And those residents, even though they have a lot of protections that regular employees don't have under existing statutes, state and federal, they get a lot of extra protections because of what the ACGME requires. Even in that space, we're seeing the organizing that Stephanie was talking about, and a really vocal and active workforce. And so long gone are the days where doctors, sat quietly, put up with terrible working hours, and were quiet about it. Those days are gone. And so all healthcare employers really need to be paying attention to these trends and keeping their workforce as happy as possible in a preventative way. It really goes a long way.
Yeah. Well, there's definitely, obviously, a lot to think about and take into consideration in this healthcare space, and pay transparency and pay equity are just the tipping point, it sounds like, for a lot of other issues that are coming up and new trends. So I thank you, Sarah and Stephanie, for chatting with me today about all of these. It's always a pleasure to spend time with you, and I hope everyone has a wonderful rest of their day.
Thanks for having us.
Thanks, Laura.
Thank you for listening to Jackson Lewis's podcast, We Get Work. As a reminder, this material is provided for informational purposes only. It is not intended to constitute legal advice, nor does it create a client-lawyer relationship between Jackson Lewis and any recipient. We Get Work is available on Apple Podcasts and YouTube. For more information on our topics, presenters, and other Jackson Lewis resources, visit jacksonlewis.com.